Okay.
So, again, this coronavirus, we know, originates in bats. And the bat in the wild interacts with the wild animals, other mammals that may be out there, whether it's wild cats, whether it's dogs that are out in the wild. The bat actually fights that animal, okay? Then that animal is now infected with this coronavirus that comes from the bat. The live animal markets there in China, they actually sell those animals for food production. And so there are instances where those animals will be actually boiled live, okay? So remove the fur or hair from the animal and put the animal right in boiling hot water right there, okay? And serve that meat to people who are buying food from the live animal markets. Okay? Or they give the animal to the person that say, take it home and you cook it. Either way, the virus is at that time allowed to enter into the human system once you eat that meat. Okay? Again, this is a devastating virus so far as affecting the respiratory system. That's because the area that this virus enters are the capillary linings of the lungs. The capillaries that line the alveoli, or the alveoli are those terminal sacs in the lung. That's where the exchange of oxygen occurs. When you breathe in oxygen, it goes through the trachea, the bronchi, through little bronchioles, little branches, and then to little sacs. Okay, that's where air goes. That air crosses across the alveoli, those little sacs, into the capillaries, and then that oxygen is taken into your organs. Now, when that doesn't occur because of injury from the coronavirus, you get no exchange of air. The alveoli do not regenerate, so you get no oxygen to the organs. You get organ death. You get severe respiratory failure because there's no exchange of oxygen. And therefore, these people who are already immunocompressed end up on the ventilator. They end up on the ventilator, and they're likely not going to come off if they develop the end stage of this damage, which is called ARDS, A-R-D-S, acute respiratory distress syndrome.
A lot of kids are into the vaping now. A lot of people have switched from smoking cigarettes to vapor. Would that make them susceptible to coronavirus as well, or is it just cigarette smoke?
Understood. That's a very good question. And, we know that vaping in general has put a lot of people at risk for very severe pneumonias, okay? And so just based on that, knowing this coronavirus can cause a very severe viral pneumonia, and therefore after that, get bacterial infection, I think that, vaping would likely put you at some severe risk. How much more severe or less compared to smoking, I do not know.
Well, my thing is, I know they've been putting out a lot of stuff that's been scaring people. My thing is, what would be the biggest thing in setting up precautions and trying to be careful so that you won't get the virus? Because we've been hearing everything scary, but there's very limited facts on actually what you can do to protect yourself. Because I hear people saying quarantine, but it's kind of hard because, like, in some cases, you got people that have to go out. You got things that have to be done. So besides just sitting up in the house, what are our best options for protecting ourselves?
Exactly. How can we protect ourselves? I'm pretty sure that's the question.
Mm-hmm.
I think the media has hyped this up, and the question is, why would they do that? Okay, I really don't know. Besides the think that you have competing, organizations, and they want to have the most exciting story and get things up the fastest. You also have there's also political influence. Some of the media, major media, are influenced by the actual Trump administration, and so maybe that's what's going on. Again, just preventing passage of the virus and actually getting the virus are going to be similar stuff that we've been doing for years, like even with the flu virus, and that is obviously washing our hands with a alcohol-based hand hand wash, at least 6% alcohol, or you can use soap and water. They recommend the 6% alcohol. People who are coughing, people who have a fever, people who you know are contacts, they give you, the CDC says the distance is about 6 feet. You need to be away from that individual, and so you probably want to be 10 feet away. And so wearing masks, it's kind of, it's spread by air droplets, by someone coughing into the air, and they're saying 6 days or more. So you have to clean surfaces that you continually come in contact with, whether it's the table in the dining area or tables in the children's room. Those have to be with sanitizer and mask, and then pretty much at the first sign of those symptoms, which were sore throat, fever, and shortness of breath. So those are the main ways to prevent spread of this virus.
I had no idea that coronavirus actually started from a bat. That is definitely new to me, and I have been under the impression the whole time that this virus was actually deadly to everyone. So to hear that it is just your typical virus, and of course, like most viruses, young children and elderly people are normally the ones that are affected, or people with health issues already are the ones that are, more prone to it being a fatality situation. It actually gives me, I feel a lot better. Because now I know that I can just take the precautions that are necessary, and we'll actually be okay. It's something that I feel like it was something that was really blown out of proportion. So just to have a better understanding now, and knowing that this virus is not a new virus, this virus was actually already out there, I feel a lot better.
Now, would we be able to say that this is a stronger virus than we've ever dealt with, and that a lot of people aren't immune to this version of the virus is why so many people are getting sick? Is that why that's happening? Or is it just, what is that?
I'll tell you my theory on this. My theory on this is that there was a lot of criticism of the current administration, of not just having the basic information out there about the virus. So once they were criticized, then they just went completely opposite and tried to seem like they were doing so much and really much, but just scare people and overblown. I mean, we've had babies that have been born with the coronavirus. So the mothers were pregnant, they had coronavirus. The baby was born with it and had nothing but like a runny nose or mild symptoms. That's it. Baby's doing fine. We've had 94-year-old people already recover from the coronavirus. So a lot of stuff that you're hearing from myself about the coronavirus, you won't hear on CNN, you won't hear on Fox, because you have to realize what we're dealing with. We're dealing with China. China is a big exporter of lots of things the U.S. needs. A lot of the simple stuff like our IV bags come from China. A lot of our critical care medicines that we use in ICU come from China. Mm-hmm. And so
they're our biggest supplier of everything.
They're not going to say a whole lot within the country. But those are the facts. I mean, they're eating bat soup. This is all on the internet. They are selling the live animals at the live animal stores in China. They're infected with this coronavirus, and so that's why we have this. Unfortunately, some of it is, I guess, cultural for them, and then I guess some of it is they see it as a delicacy, So yeah, I'm not sure, but it's all over the internet. You can just type it in. I'm not making this up. It's not like Dr. Hall wants you to say something bad about another country, but that's what the current over there that caused this coronavirus and why we have this pandemic now.
Well, I think that it's just a relief. It'll be a relief to a lot of people to know that we're not any intimate harm. And on top of that, people fear the unknown, and that's always been a fact. So when you're not educated and you don't know where to go to look to, get the resources that you need to gain the knowledge of the COVID-19 virus, you don't know. So it's a scary thing when you start seeing the government threatening to shut down, and stores closing early, and you're limited to one egg, one carton of egg, one loaf of bread,
no butter, and no toilet paper.
Yeah,
it seems scary.
It's a scary thing, and people are terrified right now because they don't know what is next. This almost feels like worse than war, because at least we know that we know
war is coming.
But with this, it's just kind of like, what's next? Where do we go next? What's next? Nobody knows anything. We only know what they give us on the news.
Exactly. Yeah, and I would tell you, just my most recent shift in the emergency room, we had 3 people come through who were actually positive for the coronavirus. And one individual apparently had been there 2 days ahead of time. This is in Mississippi, out in the Delta. Had been there 2 days ahead of time and was diagnosed with the flu. And so I'm sure he spread the coronavirus over the whole week at that time. But he was tested in, and then the test comes back 24 hours later. He shows up again. They realize he has coronavirus. He's really sick. He's a older person, and so I think he was admitted or sent somewhere. But myself, I'm sure I've already been exposed to it because, like I said, just my first shift, there were 3 people who were positive. So I'm on the first line dealing with it, and I'm not particularly concerned about it.
So what is going to be, and there's a lot of people that have said that they have self-quarantined, and like they've said on the news, there are people, I think what makes it dangerous is that, like, for example, we're sitting here together and none of us could have symptoms, but all of us could have it. And then we come in contact with somebody who's sensitive to it and they drop dead. So I think that's the real fear, is not so much that it's out there because it's as common as the common cold or the flu. It's the fact that for every person that isn't gonna die, there's like 2 or 3 people that might get sick, go to the hospital, and be severely jacked up because they're sensitive. Their lungs aren't good, their immune system is horrible, and the next thing you know, they're not doing well. So I think that's the scary part of why they're trying to quarantine.
But I wouldn't understand that. Oh, okay. I'll let you go ahead and talk about it.
No, very, 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 very true. Yeah. Again, how fast this virus has spread is the most alarming thing, and it's just the unknown. And so we're still in the early days. The CDC and also the World Health Organization, they have what are described as situation summaries, when they put out about every 24 hours the total cases and how many have died. Our source here in the United States would be the Center for Disease Control on mostly all the diseases that we experience here. The recent situation as of March 18th, there have been a total in the United States of 10,442 cases. Of that number, 150 people have died. And so you can see now that we're moving to a lower case fatality rate than what we felt. I mean, you have 150 divided by 10,000, so that number is going to be getting close to 1.5. And as more tests come in positive, again, these people were already positive. We just have a test now that we're testing it, and so now the numbers are going up. But we should certainly use all the precautions, all the prevention to stop the spread of this short time quarantine stuff is probably reasonable just to stop the spread. They're saying to keep people apart, we won't spread it so much, so that's reasonable. Once the vaccine becomes available, I estimate it's probably going to be maybe 3 months, okay, because again, they've already synthesized it. They're testing people as of yesterday. see how well it works. And so I think probably about 3 months we'll have a vaccine. And then once we have the vaccine, it'll be something like the flu, how we have the flu vaccines, and then you don't have any cases. And so I think this, with time, again, the Trump administration, I think they blew this up after they were criticized. Then they went and just created a storm and put a lot of people in fear. So.
And do you think that because I know Donald Trump is saying that he feels like that the economy is going to bounce back and all that other stuff. So should we be worried about that? Because we've got to be away from each other. People can't work and all of those sort of things. Is that, in your opinion, and I know you're a doctor for medicine, so that's not necessarily something that you deal with, but for your opinion, do you think that the economy is going to bounce back, or is this going to have a severely negative effect because we have to quarantine?
Yeah, this is, again, it's going to have a severely negative effect because they're canceling. Again, some people aren't going to work. And really, there's been not an answer to people who don't go to work and who can't make money to take care of themselves. That's another issue. I mean, I don't know what the whole administration is going to do about that. I heard some type of public promise that people will be getting money from the government or something because of this coronavirus being out of work. But I haven't seen any legislation or anything in paper, guaranteeing anyone anything. So, we're going to have, there's a lot of issues. When you start scaring the public, then, we're in a situation that is pretty devastating, which is what we have now.
Wow.
And the other thing I would really like to point out here that's very, very important, again, is how the children are being affected. Okay? We have all these cases, but believe it or not, we have very few, if any, children being affected in different parts of the country. And that, again, their immune system is strong. The other thing that the other theory is that they thought that, children have some coronaviruses that already live in them, and they're thinking maybe that children may have some type of immunity to that coronavirus. In other words, the body has synthesized some type of protein, or what I describe in simple terms is an antibody is nothing more than a lock, and the virus is the key. So an antibody and a virus is just like a lock and a key, okay? So when the virus is floating around in your blood, your body has produced these antibodies or proteins or the lock. They combine with the key, the virus in your blood, and then once that complex forms, your body can remove the virus from your body. But again, you have to have a strong immunity to generate those antibodies. When you don't have that, that's when you end up in a situation with people who are over 60 and who have comorbid conditions. So.
Wow. So, and that was a curious thing too, that there are no little kids that are having it. Like, because I guess the original statement was that older people and babies. Mm-hmm. But I haven't even seen any cases where any babies have gotten sick or died. That there's no reports of any infants or babies or any of them dying. And so when you say that pregnant women have given birth to babies that were positive for coronavirus, they come here immune to it already, almost.
Exactly. Yeah. So looking at that, and then the thousands of people who have already recovered from this virus, have already generated immunity to it in their system. They have the antibodies to this virus floating around in their blood. And so the World Health Organization came out and said, hey, this is the first pandemic that we can control. And the reason why they said that is because this is not a new kind of virus. There's been the number similar to it. Plus, we have the scientific ability to fight this virus. And so they're confident enough to say that, letting you know that they're not particularly concerned.
Wow. Okay.
So I want people to do the preventive stuff. Certainly, like with any virus, you have to wash hands, wear a mask, stay a certain distance away from people who are infected. But realize that the media is kind of created kind of a storm of fear, and so that's how to do our citizens need benefit.
Wow. Well, that was deep. Like I was really, not to say that I was sitting at home shaking in my boots, because I wasn't, but I'm just trying to, I don't necessarily want to be sick at all, period, regardless of what it is. So it's like, if you sick, I don't want what you have. I don't want a sore throat. I don't want to cough. I don't want any of it. So in my head, the best course of action would be, with so many people popping up with it, would be to stay home. But at the same time, it's like they make it seem like the world is coming to an end, like everybody gonna die today. And that's the way they've put it out there, is that everybody is just simply going to drop dead. And so that fear becomes overwhelming to a lot of people, especially considering some of the older people in the convalescent homes and the hospices, and a lot of those people are very susceptible. Like, for example, in New York State, they're going through it because that one facility where the epicenter was for the United States, and all those people are just dying because they were already sick and compromised anyway, and they've lost so many people from corona.
Exactly. Yeah. And the other thing is, another little fact that you realize is that right now, our children are more at having severe risk and getting very sick from the flu as opposed to the new coronavirus. The flu is doing more harm to our kids right now than the coronavirus is. So that puts things in perspective. Where is it going, as far as the coronavirus.
So what would happen if somebody contracted the flu and coronavirus at the same time? Would that be fatal and or detrimental?
I'm sorry, repeat the question. I heard something about them contacting the flu and coronavirus at the same time and get into the...
Would that be extremely detrimental if somebody got the flu and the coronavirus at the same time?
I think so. I think that... I don't know about detrimental. I think that, your body's going to be using its energy to fight two different viruses. Now, if you're a child, probably not, because, again, the coronavirus is not doing much, okay, besides causing runny nose and a cough in children, and that's it. They're not really getting sick. But, yeah, I mean, you're probably going to have an added effect with the flu and with this coronavirus. And so, particularly in an elderly person or someone immunocompromised, wow, that would be, devastating, no doubt.
That hurt my feelings just listening to it. Mm-hmm. Like, that was just horrible and devastating. And so that's why the deaths are so severe in other countries where they don't have they're still smoking, they still have, or like different places where pollution is really bad and people's lungs, they have different respiratory conditions. So then when coronavirus comes in contact with those people, they're more susceptible to falling dead than just, say, the average person. And they've said that on the news, that if your immune system is strong, the chances of you dying from it are low, but the chances of you giving it to somebody else who may not be as strong as you are a lot higher.
But that's with anything. That's with the flu,
right,
and all other things. So we ain't running quarantine for the flu.
Right. The one thing I think that makes this one crazier than the other one is that it sticks to stuff longer. The flu don't sit on stuff for 12 hours. This thing will sit there for 12 hours. And I think that's the thing. And people don't wash their hands. So I think that's part of the problem, too.
Exactly. And then you have to realize sometimes in other countries, they may not have all the advanced type of training, medical personnel, pulmonologists. You need the actual ventilators, okay? When these patients start getting very, very sick and you're overwhelmed with 200 elderly people and you only have, say, 20 ventilators in the hospital, and you're a hospital that's, isolated from other places, that may be the case somewhere in Italy, then you're in a tough situation because you won't have enough ventilators for everyone. So.
And they've said that. They've said on the news that they don't have enough, that their hospitals are overwhelmed, that they don't have enough equipment for the amount of people that are sick. And their population, much like China's, their older people live longer. So they've got a higher population of people that are up in age than other places do. And they keep their elderly people, I don't think they do a lot of convalescent. Like, we have a lot of convalescent homes here in the United States. So a lot of our aged and elderly live away from their families, which is why you have these large populations of people passing away in convalescent homes, because they're not at home. They're in a facility where everybody's cared for together.
Okay, so Dr. Hall, what is the best advice to give someone who has already contrasted the coronavirus at this point?
Exactly. Excellent question. So, if you already have contracted the coronavirus, and that means that you have a positive test, then you have to, first of all, you take care of yourself, and that means treating your simple symptoms like for fever, for cough, and not spreading it to family members, okay? And not having the virus around. Surfaces, you have to clean surfaces that are in your house. You have to quarantine and isolate yourselves, okay, from the rest of your family, by putting on a face mask, by being in a different part of the house, okay, keeping away from elderly people. And the other thing is, again, you need to talk to your doctor. Okay? You talk to your doctor and see what they're going to recommend. And in mild cases, they're going to recommend symptomatic treatment with things like Tylenol for fever, cough medicine for the cough. When do you need to go to the emergency room? Okay. Actually, they really don't want you to come to the emergency room, but when I guess I can say this. When is there a situation where you might need to call 911, I guess? So I would say severe shortness of breath, and that's characterized by, I've heard there's a lot of burning in the chest. The patients describe burning in the chest, like it's burning or chest pain, but not like chest pain like heart attack, but burning, and then unable to catch your breath. And then the other thing is altered mental status, where the patient is not making a lot of sense. They're very delirious, lethargic, and again, that's because they're not getting oxygen to the brain cells, and therefore they become very confused. So those are the main reasons why you said, hey, we might need to call 911. This guy, he's confused, he's cyanotic looking, blue looking around the lips, and yeah, basically severe shortness of breath.
So when the pneumonia, when you start developing symptoms of pneumonia, where your breathing is now no longer giving you the amount of oxygen that you need, is when you need to go to the hospital or be rushed to the emergency room.
Exactly. Otherwise, if it's mild symptoms, they really want you to stay home. They do not want you to come to the emergency room with mild symptoms.
Yeah, because I mean, you can hydrate yourself. There's things that you can do at home. Hydrate yourself, so I'm told. I'm not sure. And Tylenol,
right, like
you said, and to, like you said, quarantine yourself from the rest of your family.
So we're basically ride this thing out like any normal case of the flu. The problem is it's a case of everybody at the same time having the flu, whereas normally it's not everybody. So that's what makes this a thing, because everybody has it. Like, so many people have it at the same time. And it's so widespread.
Exactly.
Okay. So we overrunning the hospitals because it's too many people getting sick at the same time. That makes sense.
That's right. Makes sense.
Well, Dr. Hall, thank you so much for the clarity. And we are just really excited that you were able to come on and share with our audience and with us some facts about the coronavirus. Like, I had heard that this might have been around before, but you really gave some clarity and kind of made me a little sick for real with the whole boiling of the fluffy animals and the fur. But, you know, it kind of made me a little nauseous. But
no problem. My pleasure. I'm always happy to be on you guys' show.
We love having you.
We do.
Appreciate it.
You are our resident expert at this point. You're our doctor. So
you are go-to. If it's anything medical, I'm gonna call you.
Awesome. No problem. I invite you.
Well, thank you so much, Dr. Hall, and everybody else that's been watching thus far. This is The Conversation. So if anybody has any questions for Dr. Hall, if you're not able to share them now, we will have answers to questions. Like if anybody has any questions after, like if you watch the replay, we will definitely share those questions with Dr. Hall and get answers for you. So you can ask any questions at The Conversation on Facebook, and we will definitely get those questions answered for you. Thank you so much, Dr. Hall. Thank you to our audience for watching, and this has been A Sister's Point of View, The Conversation.